ADHD is an executive functioning disorder, which essentially means that your planning and organization are not to the point where they should be. As an adult, we need to plan how to save money. We need to plan our meals. We need to plan to pick up our children from soccer. And so if that area of our brain is not functioning to the best of its ability, we might miss out on some of those opportunities or not do them well.
There are three main types of ADHD that we talk about. Hyperactive impulsive is one type, inattentive is one type, and combined is the third type that involves all three of those domains.
So hyperactivity, they're fidgety, they can't sit still, they might jump from topic to topic.
The impulsivity piece comes in when things are happening that might be somewhat risky, things that are done without much thought. And then the inattention piece is, as it sounds, a real difficulty with focusing and attending to the thing that's right in front of you. ADHD, much like most mental health disorders, is genetically based. So we think about imbalances in certain brain chemicals called neurotransmitters, in particular norepinephrine and dopamine.
So I think adults go and seek a diagnosis because they notice that they're not being as effective in their lives as they would like to be, or their relationships are really struggling because their partner is saying, hey, can you do these three things, and one thing gets done because they got distracted by something else.
So for an adult to have a diagnosis of ADHD, they would have a comprehensive evaluation with a mental health professional, and they'd be asked all sorts of questions about hyperactivity, impulsivity, and inattention, and how those things might affect their personal life, their work life, and other parts of their life.
When I was told that I had ADHD, it was actually a huge relief because I had an answer. Living life without an answer, you internalize it and think there's something wrong with you, and that just spirals you into a whole negative space. And so, I felt like there was hope for once.
When adults are diagnosed with ADHD, it is often a sense of like, aha, like this is why school was such a struggle. This is why managing my home is such a struggle. This is why, I've had so much trouble with relationships.
ADHD is treated with medications very effectively. So there are two main classes of medications for ADHD. One would be the stimulants that work on the dopamine and norepinephrine imbalance in the brain. There are other medications that we refer to as non-stimulants, and those medications work on other neurotransmitters in a different way.
Therapy can always be helpful in treatment of ADHD, and organizational skills training would be very helpful for an adult to learn how to organize and strategize, how to not lose the keys, or how to keep track of deadlines and projects. So one patient that I had, she made this comment when she started treatment. She said, I'm walking around the city and I never realized that I was walking around in a fog. And after starting treatment, I walk down the same blocks or go to the same museums, and it's like I'm seeing things for the first time.